the number of CT scans for the US population has been growing rapidly from past 10 years at a rate of approximately 10% per year. The average effective dose to US population in general right now is put at 3 millisievert per year per background radiation and 0.6 millisievert from the medical exposure. But in general, let's say the average annual effective dose from a background radiation such as radon, cosmic, terrestrial, and internal exposure is about 3 millisievert. Compared to that, an abdominal or pelvic CT is about 10 millisievert, which is almost 3 times the annual background radiation dose all at one time. The reason why we normally compare to the chest X-rays, that's one of the most commonly done medical exposure, radiographic exposure when in the hospital. So compared to that, a chest CT, I'm not talking about cardiac CT, just a regular CT, a chest CT, is about 5 to 7 millisievert. What does that compare is like? If a person get a chest CT, he or she is getting approximately 50 to 70 chest X-ray all at one time. Compared to that, an abdominal pelvic CT is usually 80 to 100 chest X-rays all at one time. In addition, put it in perspective, the cardiac CT, when you're doing cardiac CT procedures, there are 2 different type of procedures normally done. One of the low dose procedure is typically, which you commonly hear, is calcium scoring procedure. Calcium scoring CT scans are a very low dose procedure. That's typically around 10 to 20 chest X-ray, whereas a cardiac CTA, the CT angiography procedure, which looks into details of the stenosis in the arteries, blockade in the artery in all direction, that particular procedure can yield a radiation dose equivalent to about 100 to 200 chest X-ray all at one time. That's where the concern is. On top of it, having a person getting a repeated CT scans over a short period of time is of concern. That's the main concern. That's a very important question, or a very significant question. Benefits these CT scans have resulted in saving patients. And that's one of the reasons why we are seeing more and more CT scans housed in the emergency room department. However, there is also raising concern is like some of the time the patient is performed the CT scan for not substantial reason. For example, a patient walks in with some acute pain, and the first thing the physician does is to do a CT scan. How many of these are important, are appropriate? That's the big question one needs to answer, because an abdominal and pelvic CT together is equal to about like taking about 100 chest X-ray all at one time. Well, when we are talking in terms of the increased mortality risk, let's say, it's very it's kind of like a little bit of a stretch, but still, if a person gets a multiple of these scans in a very short period of time, that can increase the overall risk. Let's say, in general, when we want to put in terms of cancer risk, we also put in terms of the natural incidence of total fatal cancer. For example, in the US, the natural incidence of fatal cancer is approximately 25%. On top of it, if a person gets a CT scan of an abdomen, which is equal to 10 millisievert, that can increase the risk to 25.04% increase. So there is an increase of 0.4% on this fatal cancer risk. But if the person gets a number of these scans over a period of time, that can increase the risk substantially. If a proper whole body CT screening is done, usually it's done with contrast. So the radiation dose can range anywhere from 10 to 20 millisievert. That's about almost having like 3 to 6 years worth of background radiation all at one time. There are a lot of false positives after this CT screening. When there is false positives, what happens then is like this requires an additional CT scans and additional diagnostic scans that in turn increasing the radiation risk to the patient. If you look at the first slide I showed earlier, what is happening here is anything less than 100 millisievert is still which has a big range of margin of error for this data. The reason is like a Health Physics Society has put out a white paper on this aspect, telling anything less than 10 millisievert, between 50 millisievert and 10 millisievert, there is some risk, but below 50 millisievert, there is no statistically significant risk being shown in this population getting up to 50 millisievert. So we are talking about between 50 and 100 millisievert, there is some increase, but beyond 100 millisievert is the concern about, there's a concern in the medical community. How do one get 100 millisievert, let's say? If you are doing like a cardiac CTA or cardiac CT angiography study, and if somebody gets about 4 or 5 of these in a year, the cumulative can add up to more than 100 millisievert. That's of concern. The reason is, like, again, if you look at the data, there is a big margin of error bars on this graph. These reports come up from this survivor population data, wherein the Hiroshima Nagasaki survivor population were exposed to a different type of radiation, and also with a very high dose all at one time, and all totally different type of radiation compared to the medical exposure we are talking. Usually the diagnostic X-ray range are at the range of 150 keV, compared to the Hiroshima Nagasaki population received all sort of high radiation, neutron exposure, and very high level of radiation. So we are trying to compare slightly a different, like an apple to orange comparison of the type of radiation risks here. That's why we always play a little bit, we are always a little bit conservative, telling like it's a little bit of a stretch to extrapolate back to 20 millisievert. A coast-to-coast flight at an altitude of 35,000 feet is listed approximately 10 millirem, or 1 chest X-ray, equal to 1 chest X-ray. So a coast-to-coast US flight from New York to California at a height of like 35,000 meter can result in approximately, you need about 100 of them to reach a abdominal or pelvic CT doses. Again, radiation dose, especially on the intercontinental flight or the cross-continental flight, depends on the height, and also depends on the solar flares, the latitude and longitude, and sometimes the activity increases because of some solar flare. But somebody is doing a lot of these flights, like the air hostesses or pilots. They're usually monitored by varying radiation bands, and they also work under the same regulatory requirements of 50 millisievert annual exposure for their whole body. Two types of scanners I can mention. One is a backscatter scanners, which we are seeing in the news these days, which is substantially lower radiation dose, is equal to about, you need about 1,000 of these scans to equal to 1 chest X-ray. So that's the numbers which I am aware of it. On the other hand, the limited use scanners, which is called as a transmission scanner, which is used very in a limited use, are substantially higher. That's equal to about, if you do about 10 to 100 of these scans, that's equal to 1 chest X-ray.